Joining America's Doctor for a discussion about empowering yourself and your family are Dr. Gamal Wazi from United Vein Centers.
All right, Gamal, let's start with you. Gamal is a world-class vein expert. Has a practice in town. Many of you probably know him already by name. He's decade of experience in this specialized field, and one of the first docs to use vein lasers as well. But the reason I wanted him on the panel is he knows a ton about a problem that many of you asked me about on the show, and not all veins are the same. So I'm going to ask him to speak at a high level to get us all on the same page, and once you find yourself in the areas he discusses, we'll get more specific. So explain for the average individuals who's here today, what is vein disease? How do you think about it in a way that we can organize it in our mind and then decide what's right for us in treatment?
Well, Dr. Oz, looking at the poor St. Lucie crowd, I don't know, they look perfect. I don't even think they have vein disease. Vein disease, known as venous insufficiency. What happens is you have veins in your legs, surface veins, that act as highways, and they take the blood back up to your heart. With time, with age, and sometimes due to hereditary reasons, these veins become diseased by becoming stretched, dilated, and their ability to return the blood from your legs back up to your heart becomes very inefficient, and the blood starts to pool in your legs, and especially if you've been standing all day because of gravity. And when it starts to pool, you'll notice that your legs will start to swell from the accumulation of the blood. They may start to ache from the stretch and feel heavy because blood is mostly water and water is heavy. At night, it could affect you also. The accumulation continues in these diseased vessels, and you may start to get calf cramps or restless legs, and that can really affect your sleep. So in a nutshell, that's the vein disease for you.
Treatment, and I know there's many things that can be done now that were never imaginable even when I was training. So if you could organize that a little bit for the audience, and I'll give you a little reprieve.
When you were training, probably stripping.
Yes.
Stripping is very barbaric, classic, rolled into the operating room, general anesthesia, the veins are ripped out, as barbaric as it sounds. Weeks and weeks of downtime, bruising, pain, probably 4 to 6 weeks of downtime. And today, due to technology, we have these sophisticated lasers and ultrasounds. So you're able to drive to your doctor's office, walk in, they image your leg with an ultrasound. It's a bit like an x-ray. How an x-ray is able to see, say, broken bones under the skin, an ultrasound can show the doctors and their team the diseased vessels under the skin. They then will thread small laser fiber through a nick in the skin into the vessel, float it up the vessel, and we can image it with ultrasounds. And once we're happy with its placement, and mind you, the patient is awake this whole time, just a small office procedure. Once we're happy with the placement, we turn these lasers on, and the heat will seal the vein shut, and your body will absorb it. Phenomenal compared to the old methods we just spoke about.
Then you wrap the leg for a while till the vein seals down?
Actually, the heat of the laser will seal it, or should I say burn it. There's really not many wraps these days. We've even moved away from that. We'll put on compression just to keep the circulation going.
All right. Dr. Wazni, you talked about venous disease and how to treat it. What are the medical consequences of not treating venous varicosities? It's not purely a cosmetic issue.
No, not purely cosmetic at all. Actually, when you're pooling blood in your legs, the complications can be venous stasis ulcers. What happens is you're holding blood in your legs for so long, it starts to put pressure on the skin from the inside out. And that starts to break the skin down, and you get these ulcers. In addition to that, blood clots. We know now that a big portion of DVTs are due to the stagnant blood flow. So you are at a higher, studies are showing you're at a higher risk for blood clots if you're pooling blood in your legs.
If you're at all on social media, and I want you to post what you liked the most, what caught your attention, some fact that you took away from this session. And again, use hashtag DrOzFest and post it to my any of my social sites, you just search Dr. Oz, and if you're on Facebook, Instagram, Twitter, wherever, you'll find it immediately. And then I want to ask the panelists to give you one last thing they want you to know about them, and then tell us the best way for people to get in touch with you, a website or a social site, how you can interact the best. So Gamal, let me start with one quick question. The youngest person you've done a vein procedure on, and the oldest person you've done a vein procedure on, and then tell us how to find you.
The youngest person was probably 21 years old. She had a serious family history of it. The oldest person was 84. And he had wished he had done it years ago.
And he had pain?
Pain, aching, couldn't sleep at night because of the cramps. And just wished he did it 25 years ago, he said.
So one thing they should know about you, and how do they find you?
Myself and the physicians on our team are dedicated to treating vein disease. We love it because we want you to feel good. When you feel good, we feel good. You can find us at UnitedVeinCenters.com.